Hello and a very good evening to you. You're watching News 9 Digital. I'm Pratibha. Thank you for joining me live today. Over 7 months after Karnataka reported the first COVID-19 death in the country, and that was on March 12th, the state's death toll has now exceeded 10,000. This was on Monday, and it is the third state to have recorded 10,000 deaths, while over half of the total deaths were among those who are aged above 60 years of age. The Department of Health and Family Welfare Services, the data from there show that over 41% of the total fatalities being reported in Karnataka were reported after September 1st. No doubt, Bengaluru is the worst affected place in entire Karnataka. The COVID-19 positivity rate in Bengaluru itself is also quite worrying. There are fears that not enough testing is being done, and the positivity rate is also quite worrying, and it has now fallen in the last 2 months. And this is yet again happening according to the data by the BBMP War Room. The positivity rate from October 1st to 10th is 14.53%. Now, while the case trajectory in Delhi, Pune as well as Thane seem to be showing some signs of slowing down, many cities such as Bengaluru, Mumbai and Kolkata continue to face the heat of the infectious disease. And that's quite worrying, because Bengaluru at the third position right now is set to topple, it's set to be on the top for the city that is worst affected. And on an average, the city has been witnessing 39 deaths every day over the past 7 days. So it's quite worrying, as is. The numbers have only been increasing. To discuss more on what are the reasons why the deaths are quite high in Karnataka, even though the cases are pretty much in control as compared to the other states, Dr. Prakash Kumar, retired Joint Director of the Department of Health and Family Welfare, joins us. Dr. Prakash, many thanks for joining us.
Yes.
The cases don't seem to be as high in Karnataka as they are in a few other states. Despite that, the mortality rate is quite high in Karnataka. 10,000 deaths that have been reported in the state, and it's only the third state to have reported so many deaths. So what would you say are the reasons for it?
No. When you compare India and Karnataka, our case fatality rate is about 1.4%. Whereas the Indian case fatality rate is about 1.5% as on yesterday's report. When you take up the number of deaths in Karnataka, although it is increasing, the case fatality rate is supposed to be about less than 1%. Usually in any pandemic cases, that shows the importance of the surveillance and selection of cases. So what is happening in Karnataka? We are supposed to concentrate on the quality of testing, not the number of testing. So because what is happening, if you don't concentrate on the quality of testing, we are going to miss the important cases, and also there will be overloading over the labs. When you take although Karnataka is testing more in the entire country, there is overloading of the labs, so we are getting reports late. When the reports are getting late, cases are not lifted to the hospital. So the mortality, usually when the cases are lifted late to the hospital, the patient will go for complications, the mortality will be high. And the second more thing is, we are supposed to prioritize the hospitals for case admissions. That's very, very important.
True.
Because serious patients, there are certain high-tech hospitals, tertiary care hospitals are there. Important serious patients are not getting beds in the important tertiary care hospitals. So we have to grade the hospitals and select the cases, and we have to shift the cases by grading the hospitals in different categories. That plays a very important role to reduce the mortality. Just lifting the case and admitting in some hospitals without seeing the clinical condition of the patient is one of the reasons to increase the mortality in Karnataka.
So early detection and, like you mentioned, the testing as well, because I think quite recently the Karnataka Chief Minister had also spoken of how the rapid antigen test should be reduced and the RT-PCR tests should really be increased in Karnataka, and that can be one of the...
Yeah, definitely. What is happening, see, my capacity in Karnataka today, what is the RT-PCR capacity? I am supposed to collect so many samples so that there will not be delay in getting the results, and there will not be delay in shifting the case to the hospital.
Okay.
See, just collecting more samples without having capacity to test those samples in that day, it will lead on to the overloading of the samples and also pending of the cases shifting to the hospital.
Okay.
This is important reason why we are getting more mortality in Karnataka. We have already, government of Karnataka has taken steps to solve this problem.
Okay.
And also we have to importantly categorize the hospital for shifting the patients. That also plays a very important role.
Okay. Okay, doctor, and as we've seen in the coronavirus cases across the world as well, those senior citizens as well as those with comorbidities are the worst affected. That's the case in Karnataka as well. The younger age groups, not so much as the older and comorbid cases. That's the reason why, to ensure that our fatality rate improves so that, it reduces further. Would you say that concentration should be more on those who are elderly as well as those who have any comorbid conditions?
No. Very, very important. We have to trace the comorbid condition elderly patients as early as possible.
Okay.
And we have to test them as early as possible so that we can reduce the mortality. That's way we have to focus on the comorbid patients, especially those who are symptomatic. That's very, very important. We are not supposed to dilute the testing, quality of testing. We have to concentrate, we have to pick up in the community all the comorbid symptomatic cases as early as possible so that we can reduce the death rate.
Okay. Okay, doctor, lastly, do you see a lot of people being hesitant to even get the coronavirus test, whether it is stigma or fears of, having to go to the hospitals? Because of various reasons, people hesitate to go to the hospitals, and this was one of the reasons why Karnataka's mortality rate was high initially as well. It's because of the late testing, because many were not very comfortable going and getting tested for COVID-19.
Yeah, what is happening is, we are unnecessarily testing certain people. There are clear-cut guidelines issued by government of Karnataka. It is not the number is not important. It's clear-cut guidelines for the whom to test, where to test, and how to test. Because quality of testing is also important. Nowadays, they are involving the volunteers. They are not lab technicians. They are only the trained people. So we have to concentrate to train them further and to get the quality of sample from the people so that we can have the quality of testing, and also even though the patient is positive, we may get the negative result if we don't get the quality of the sample. So in this way, we have to concentrate on in this aspect also.
Okay. Okay, all right. Dr. Prakash Kumar, many thanks for joining us with your expertise on the subject. So, in Karnataka, there were a few issues that we were facing initially, and these are the persistent issues that we are facing even now. Of course, now the Karnataka government has also formed a task force, so to speak, a committee that has been formed to ensure we look at the mortality rate that's quite high in Karnataka. Very recently, when Prime Minister Modi had spoke to the Karnataka Chief Minister, B.S. Yediyurappa, he had told him quite specifically to bring down the mortality rate as well, which is why a task force has also been put in place by the Chief Minister. They're looking at the reasons why the mortality rate is quite high in the state and are working towards ensuring that it is lowered. So several steps are being taken, but of course, from the people in Karnataka, what we can do is to stay safe as much as we can, wearing a face mask, ensuring physical distancing as well as maintaining hygiene. Apart from that, if you have any symptoms at all, it's always best to go get tested, consult a doctor and ensure that you know whether you have COVID-19 or not, because early detection itself goes a long way in curing COVID-19. Well, that's all I have for you today. Thank you so much for joining me live. Let me know in the comment section as well what you think of Karnataka's fight against COVID-19. I look forward to that. Thank you for watching. Take care.